2 of our revelation of 3 important papers that show the CDC has made fatal, serious errors in judgment based on serious, fatal errors in data collection. So it's bad enough that they have the wrong perceptions. Now, we've been listening to people from CROP saying they had nothing to do with the CDC guidelines, but we've now decided, based on just reading them and comparing the references that we use and the language used, they indeed wrote them or supervised the writing of the CDC guidelines. So that's why we're including CROP. Remember, that's Physicians for Reduction in Opioid Use. That group is tied to the CDC. There is no other group in the United States trying not to stop the crime. Only the medical group. There's the Department of Justice. There is the Federal Drug Police. There is the CDC. There is CROP. Nobody else. CROP and CDC published these guidelines with tons of letters from people who were alarmed at what they were doing and passing on the future projections that this is going to lead to people with cancer not being treated, people with chronic painful diseases not being treated. I heard a recent podcast by a member of COP who said that the only time you really need medicines, opioid medicines, is maybe for 3 days after you have been operated. And that was it. The person being interviewed from CROP said there's really no reason to use pain medicine for any other problem, certainly not for bad backs and molar stuff. These are the old saws that they use. We shouldn't be using these for low back pain, tooth extraction, because then people become addicted. This same interviewee said that there were millions and millions of people addicted. Now, that's not true. There's been 1 million people a year, roughly, for the past 10 years, and we found, of course, as you've heard before, that the rate is the same as what 1920. So let's go back to 2006 with this god-awful assault on patients. 9% of the overdose deaths. Patients are not part of the problem, but they were made to be part of the problem in 2006 by Leonard Pelosi, a CROP member and CDC member, telling everybody, telling the world that it's prescription drugs, not heroin. So this paper generated a couple of very serious rebuttals. One of them was by Scott Fishman, who has written books on opioid treatment. He's a full professor at the University of California in Davis. And listen to this. This is 2006. He wrote this as a response to the Pelosi paper. As detailed in the accompanying commentary, this may be faulty logic based on inadequate data. So that's what was confirmed. Faulty logic that patients were responsible for opioids based on inadequate data, which is detailed here. Now, at the same time, this nice paper came out from Pippin and Coleman, that's the medical school director, doctor, and journalist. But at the same time, this amazing paper was published on Medium, and it's called The Scrutiny of CDC Overdose Data Yields Explosive Results. Now this author, D.S. Nelson, who has a website or a Twitter account with 5,000 people on it, she did an overview of the Coleman paper from last week and the Stuff paper from 2018 and tied them all together. This is really a gem. And not only is it covering all the stuff that's covered in the other papers, it's really pulls things together, and CDC misses critical health signals. Most Americans will be shocked to learn how much private health data is captured by the CDC. 51% of death certificates were wrong in Vermont, yet the CDC based all of their data on death certificates. So not only were they off by 50% from their data, but they're off another 50% because of inadequate death certificate data. Okay, she mentions that methadone was part of this, and benzodiazepines. So we're telling people they can only have a benzodiazepine or an opiate drug. There's no data whatsoever to support that. That is a hostile, prejudicial maneuver on the part of physicians to punish people who've now been labeled as pariahs. And who are they labeled as pariahs by? Prop CDC. These were not considered pariahs prior to them becoming involved. The federal government has become involved in interfering with the doctor-patient relationship. She, as Nelson, says that this nice paper written by Pepin and Coleman was a scathing commentary released by two researchers. And then she immediately goes into the 2018 paper from the CDC. And pretty much she lists the, also error coding fentanyl. I mean, what's left? They made errors coding everything. See, that's the problem with doing medical research, just using numbers. President Trump wanted the Department of Justice to go after doctors based on analytic data. Don't interview the doctors. Don't do a police investigation. Just go by the numbers. CDC ignored the problem until 2016, which showed serious inconsistencies. They were told by Congress to modernize in 2018. They've ignored that. And the other problem is we have this big book with 100,000 diagnoses in it, and there's little numbers, and you write down the numbers when you have a diagnosis to get paid. Well, there's problems with that, because that didn't cover all the categories of the drug overdoses. And so these super things were following these 5 numbers to code all death. And then there were a lot of 20% of the death certificates didn't have a drug on it. So, in essence, says Nelson, the CDC has potentially been compounding this error every year since 2005. 2006, Leonard Pelosi, that's all tying together. In other words, there was a big jump in 2005 and 6 of reported overdoses due to prescription drugs that were in error. So Pelosi, MD, epidemiologist with a big background in math, should have known better. Why didn't he know better? That's for something for Congress. He should have known better. So he was producing this document that says, don't worry about heroin anymore, based on the wrong data. So this ties that all together. She mentions that it's been a decade. The popular narrative is to save people from overdosing on prescribed prescription medications, even those who are dying, we must further restrict access to the medical supply. Okay, we are now as the National Pain Council, we are of the official premise that drug use does not cause addiction. Addiction causes drug use. This is in a lot of papers. It's supply versus demand. So for more than 50 years, we've been working on the supply problem. That hasn't worked. $600 billion. We are sitting today without a proof of a single overdose death prevented or a single heroin addiction prevented. Not one. $600 billion. And that came from the research service. Illicitly obtained pharmaceuticals. That's really a better word than the correct word CDC uses of obtained opioids. Illicitly obtained pharmaceuticals. In other words, these are approved pharmaceuticals, 80% of which are stolen on the street without being involved with doctors. Doctors have very little to do with street theft. Also, for the first time, and this was in one other paper we had, the fact that higher doses of opiates and benzodiazepines may be due to the fact that the person is sick. That never comes up, you see, because it's all about data. It's not about human beings. So the CDC really has nothing to do with human beings, and they claim that they are going to solve the world's problems. CDC has not modernized its coding system, and they were told to. Methadone, cocaine, and benzodiazepines are reported incorrectly. I mean, this is just awful. CDC accepts death certificates when they're wrong 30% of the time, creates the illusion of higher death statistics because of multiple drug overdoses, and that's discussed here in the Nelson paper, and we've said that all along. It's multiple drugs. Multiple drugs. Get a life. CDC is causing harm to millions of people, and overdose, and suicides due to being cut off, and they're running around like they don't know what's going on. Other issues need to be remedied. In spite of CDC becoming acutely aware of the fact that most of their data appear to depict either the presence of street fentanyl or multiple other substances, mostly illicit in nature, like fake Xanax. Now that's something I just learned from the Nelson paper. There's fake Xanax out there. Xanax is a very popular drug, and lo and behold, it's fake too, and they don't distinguish out of it. Be aware of the lack of drug specificity was a problem as early 2005. 2005, the year before the Pelosi paper. They've hired a PR firm that spent a lot of money to improve the agency's public image and develop a communication strategy to help educate the study about the CDC's controversial guidelines. So CDC takes our money, our tax money, hires publicists to try to get their point across instead of standing up there before a group and using logic and scientific proof for their rather idiosyncratic, views on opiates based on, as we've said before, fear of opioid phobia. So I'm just kind of looking here at the same time. Less than 1% of chronic pain patients have substance abuse. We've been saying that all along. So, we write 235 million prescriptions every year for opiates. How come more people aren't addicted? The idea of addiction and overdose deaths needs to be separated. They're two different things. Everybody puts them together, especially Prop, who writes papers about the increased numbers of addictions that nobody has data for. They're just saying things. They're like the CDC. They just make these flat statements, and they don't have any logic or proof. Okay, the narrative surrounding opioids, that they're all bad, they justified with flawed data, says the Nelson paper. On deeper scrutiny, appears to prove this demographic, which are pain patients, are unjustly accused as a significant driver of the debacle. Okay, well, I'm going to end it there. And National Pain Council, we should have on the front page a little summary of this, and also how to get these articles. We'll have some links there, and you can decide yourself. Our job at the National Pain Council is to put information out there It's up to you in the audience to decide whether or not it's true and to double check. Okay, we're not saying this is all right, but we're going to give you the references and you can go check it yourself. Thank you and good evening.